A bill aimed to support long-term care for severely disabled Singaporeans has passed in Parliament. The CareShield Life scheme aims to assist Singaporeans' medical and long-term care needs. Under the new national insurance scheme, severely disabled individuals who can't perform 3 or more activities of daily living will be eligible for cash payouts starting from $600. Everyone between the ages of 30 and 40 will automatically pay premiums for the scheme from mid-2020.
Now, for more on this, we're joined in studio today by Dr. Ng Yee Sien, Senior Consultant Rehabilitation Medicine at the Singapore General Hospital, and Janice Chia, Founder and Managing Director of Aging Asia, a consultancy that looks at products and services for healthy aging. Dr. Ng, firstly, I'll come to you. Why is this scheme so necessary for Singapore?
Right. I think it's important to address this scheme now in Singapore urgently because the rates of disability in Singapore are rising tremendously and really fast. So 1 in 2 Singaporeans by the time of the end of their life would be disabled, as well as if you're 60 now, 3/4 of your life would be spent in disability. So that's quite a big significant burden as well. And we know that it's important to do this because disability is associated with severe caregiver burden, not only financially but socially. We've seen many people which are severely disabled, the caregivers become depressed, have financial burdens of taking care of the family, and people who are disabled also have high rates of depression themselves, falls and institutionalization and nursing home admissions. So I think it's really important that we address this, given the prevalence which is highly rising in Singapore at this time.
Let's look at how onerous the criteria for determining who is severely disabled will be. I mean, how will we be able to assess, who is more disabled than another?
Right, that's a great question, Dawn. So currently, we are working with the Ministry of Health to make sure that disability assessments are both equitable as well as accessible. So disability in Singapore is assessed by the activities of daily living, or what we call basic activities of daily living. The 6 activities that we'll be basing assessments on will be eating, dressing, bathing, toileting, how you get from a seat, so say for example the seat to bed, that's called a transfer, and whether you can walk or not. So to make sure that it's easy and consistently done, we have revised or clarified the guidelines on how to assess for disability in each of these ADLs. For example, we have clarified, what would it mean by having maximal assistance or total assistance in dressing or in bathing. And these guidelines will be taught to assessors out there to make it sure it's consistent and equitable. The second thing that we are rolling out with CareShield Life assessments is also take into account people with cognitive impairments. So in Singapore currently, there are a increasing number of people who, for example, have dementia, and we have taken this and clarified how this impacts on activities of daily living, such that these people can be assessed and receive access to resources and assessment as well. And finally, to make it sure it's accessible to Singaporeans, we are also training allied health professionals like physiotherapists, occupational therapists, as well as nurses and doctors as well, to be able to assess people with disability accurately and consistently, such that Singaporeans have easier access to these assessments and equitable and equitable assessments and approachable as well. It's not difficult to do. Most of us can tell if you can't, dress or bathe, but it's a science to it, and we have clarified definitions.
Right, that consistency will be key.
That's right, absolutely.
Yeah, so let's talk about the premiums then that will come from those between 30 and 40, Janice, to be used by folks from generations much older than themselves. This affected age group, concerns about how they might feel about this?
I guess for myself, I'm at 40, and I'm one of those 1979 which I have that option to opt in if I want to. I think what this provides is a safety net for Singaporeans. Just in case of severe disability, there is something to access. But I think because this is going to impact a lot of younger Singaporeans as well, there'll be rising awareness of the needs of the aging population, the needs of their parents as they age, and as caregivers, the burden that they'll face. But I think most of all for younger Singaporeans, they also have to consider that of expenses increasing as they age in this new economy. With rising aging populations, I think the other thing we can consider is also enablement. Younger people will be the new elders in future, and they might look more towards that money being used for rehabilitation and access to rehabilitation. So in future, maybe there'll be the possibility as well of reducing the disabilities. And if you look at it, 3 ADLs is quite severe, but maybe at 1 or 2 ADLs, a portion of that money could also be accessed for some rehabilitation activities.
I suppose you also have to have quite a long-term view of how this is going to benefit Singaporeans as well.
Yeah. So as a society, we face plenty of challenges, the aging population, the falling birth rate just being 2 examples of that. What are the risks if we don't act with something like CareShield Life?
I think the biggest risk is putting money aside for this rainy day. And we don't anticipate how much aging is going to impact us, especially as a younger person. Sometimes you don't know about, in future, in the next 30, 40 years, what are the likely life events that could impact us. So I think this is about setting some money aside, and especially because it's going to go through the Medisave premiums. This is also probably more acceptable for younger Singaporeans too. But I think that if we could widen it and maybe consider in future that these premiums start when we start working, then perhaps the premiums can be lowered as well across the board. Yeah.
And Dr. Ng, the scheme works on the assumption that women live longer. The numbers back that out and bear that out. Do you generally see the onset of ill health, though, in women coming on later in life as well?
It's a challenging question. Essentially, we do see that a little bit, but I think that the bigger driver of that is the changing case mix of disease in Singapore. So, for example, in Singapore, the 2 largest growing segments of people who are disabled are, number 1, people with cancer. So because of better medical care and better cancer care, many people, for example, with breast cancer, which of course in females, and prostate cancer are living much longer, albeit with disability. So it depends on the diagnosis of that person in particular. The other big segment are for people who are elderly and frail. We see a large number of people, increasing larger number of people who are elderly and frail and disabled. For that population, there's slightly more numbers of females compared to males, and they might start the onset of disability maybe a bit earlier. But in general, I think I think general message is not so much whether it's males or females more, but the prevalence of disability is really it's really high, especially in the aging and with better medical care.
All right, well, thank you both for coming in and talking to us about this. Dr. Ng Yee Sien from the Singapore General Hospital and Janice Chia from Aging Asia.